We all know that our population of ACHD patients is aging. Everyone among you is encountering patients in their 60s, 70s, sometimes even some patients in their 80s. And this is posing a specific challenge to us as healthcare providers. We need to make sure that we have the competencies to take care of this aging group of patients. And that means that we need to have a good understanding on what is the profile of these patients, what are their specific needs, and how can we deal with that. And that was, to a certain extent, the reason why we did these analyses on data coming from Approach-IS. And I'm representing this fantastic consortium, being the Approach-IS consortium. The abstract that we submitted, we reworked that into a research letter, which will soon be published in the European Journal of Cardiovascular Nursing. And this is a journal that is working with graphical abstracts. And I decided to use this graphical abstract to guide you through the methodology and through the findings of the study. So, as indicated, we wanted to see what are the differences in patient-reported outcomes among patients at an advanced age compared with younger patient groups. And more specifically, we wanted to see if there were differences regarding self-reported physical functioning, self-reported mental health, and quality of life. Indeed, this is part of the Approach-IS study, a large-scale international study that was conducted in 15 countries from 5 continents. And we used some questionnaires because the key of Approach-IS was patient-reported outcomes. More specifically, we used the SF-12 to measure physical functioning and mental health. We used the Eurocall visual analog scale to assess self-rated health. The HADS, being the Hospital Anxiety and Depression Scale for anxiety and depression, and a linear analog scale for quality of life, and satisfaction with life scale also to measure quality of life. We divided the sample into 3 groups, and overall we had 4,021 patients that could be used for this analysis. 70% of the sample was aged 18 to 39. 23% was aged 40 to 59, and 6% of the patients was 60 years or older. And for each of the patient-reported outcomes, we made violin plots to see how is the distribution of the scores in these different variables. These are univariate analysis. So if we have a look at physical component summary, so this is an expression of the physical functioning as perceived by the patient, we see indeed that older patients do have lower scores in physical functioning. When we have a look at self-rated health, it is in line with the physical functioning. Also, older patients are scoring a bit lower in self-rated health, but it's more subtle than when we look at physical functioning specifically. Looking at anxiety, there you see that the older group is having a lower score on anxiety than the 2 younger age groups. And from a univariate point of view, there we could find some differences. We did not find differences on depression, mental health, quality of life. The tricky thing, of course, of this kind of univariate analysis is that there are differences between these groups. There is certainly a survivorship bias because the older patients will have a different profile than the younger patients. So therefore, we needed to adjust for existing differences between these groups, and therefore we conducted general linear mixed models. And based on these general linear mixed models, we found that physical component summary, so the physical functioning, indeed is decreasing over time. Older patients do have lower physical functioning than younger patient group. The mental health, although univariate, there was no difference, but when you adjust for the different characteristics of the patients, we could see that mental health was better in older patients than in the younger patients. And this was consistent with the finding that in terms of anxiety, the scores in older patients were lower than in younger patients. So let me come to the conclusion. Aging in ACHD is associated with worse physical functioning, better mental functioning, and less anxiety. Thank you very much.